Now next we are going to discuss is the larynx. The larynx lies in the anterior midline of the neck. It extends from root of the tongue to the trachea. So you can clearly see extension is from root of trunk to the trachea. In the adult males, it lies in the front of C3 to C6 cervical vertebra. But in children and in adult female, it lies at a little higher level, that is C1 to C4 level. So you have to remember C3 to C6 cervical vertebra in the case of adult males. Now the length of larynx is 44 mm in the males and 36 mm in the females. Now the larynx is made up of skeleton framework of cartilages. The cartilages are connected by joints, ligaments, membranes, and are moved by number of muscles. So larynx contains 9 cartilages, out of which 3 are unpaired and 3 are paired. The pair cartilages are thyroid cartilage, cricoid cartilage, epiglottis, whereas paired cartilage are retinoid, corniculate, and cuneiform. Now remember, thyroid is derived from Greek word and it means shield like, and cricoid means ring like, whereas epiglottis is a leaf like part. Now the first is the thyroid cartilage. Let us discuss the feature of thyroid cartilage. Now this structure shown represents the thyroid cartilage. Its cartilage is V-shaped in cross section. So you can clearly see this is V-shape in cross section. So it consists of right laminae and the left laminae. So each laminae is quadrilateral. The laminae are placed obliquely relative to the midline. So they are placed obliquely relative to the midline. Their posterior borders are far apart, but the anterior border approaches each other at angle of 90 degree in the males and about 120 degree in the female. Now the lower part of anterior border of left and right lamina fuse and forms a median projection known as laryngeal prominence. So this number 1 represents the laryngeal prominence. Now there are superior and inferior cornu. The superior cornu is connected with the greater cornu of the hyoid bone by this lateral thyroid ligament. So this is the lateral thyroid ligament. It connects the greater cornu of the hyoid bone. Whereas the inferior cornu articulates with the cricoid cartilage. So this lower one is the cricoid cartilage and this inferior cornu articulates with cricoid cartilage to form cricothyroid joint. So this is cricothyroid joint. Now let us discuss the various attachments to the thyroid cartilage. This is the vocal cords you can see on both the sides. This is the left vocal cord, this is the right vocal cord. Other is the vestibular fold. This is the left vestibular fold and this is the right vestibular fold. Another is the you can see is median thyroepiglottic ligament. Median thyroepiglottic ligament. So this is the median thyroepiglottic ligament that are present on the inner aspect. So other is thyroepiglottic muscle that are present on the both side. So you can see this thyroepiglottic muscle present on the both side. Here in this figure you can see the curved epiglottis above and the bulges of arytenoid below. The triangular gap that is present between the vocal cord is glottis. Above into the side of two vocal cords there are false vocal cords. And this is the esophagus that you can see. Some landmarks may be difficult to see during the difficulty. Now next comes the cricoid cartilage. This cartilage is shaped like a ring. So you can clearly see this outline showing the ring. And it is a complete cartilage. So it encircles the larynx below the thyroid cartilage. Now remember, the ring has a narrow anterior part that is known as the arch. So this is the arch and the broad posterior part. This is the posterior part called as the lamina. So this part is broad. The lamina projects upward behind the thyroid cartilage and it articulates superiorly with the arytenoid cartilage. So these are the arytenoid cartilage and hence it articulates. So next comes the epiglottic cartilage or epiglottis. It is a leaf-shaped cartilage. So you can see this is a leaf-shaped in the anterior wall of upper part of larynx. So its upper part is broad and free, and this is the upper part and it projects upward behind the hyoid bone and the tongue, whereas the lower end or thyroepiglottic ligament, though this is the thyroepiglottic ligament, it is pointed and attached to the upper part of angle between the two laminae of the thyroid cartilage. Now moving to the arytenoid cartilage. So these are the two pyramid shaped cartilage lying on the upper border of lamina of cricoid cartilage. Now the apex of arytenoid cartilage is curved and it articulates with the corniculate cartilage. So these red colors showing are the corniculate cartilage. Its base is concave and it articulates with the later part of the upper border of the cricoid lamina. And the base is prolonged anteriorly to form the vocal process and laterally to form the muscular process. Corniculate cartilage, or these are known as Santorini cartilage. These are small conical nodules which articulates with the apex of arytenoid cartilage. Next is the cuneiform or Risberg cartilage. These are two small rod-shaped pieces of cartilage placed in epiglottic fold just ventral to the corniculate cartilage.